Doctor, tell me a little bit about what is TMJ and how would I know if I have a problem with my TMJ?
TMJ, everyone has TMJ, first of all. TMJ disorders are the one which we are talking about. If you have clicking, popping sound in your joint, if you have headaches almost like 2 to 3 times in a week, pressure behind the eyes, ringing sound in the ear, then you have TMJ disorder going on, which needs to fix by some treatment.
Got it. And where is the TMJ in the jaw?
So we have 2 joints right over here. The mandible, which is connected with the cranium. So this is our head cranium and this is the mandible. And where it's connected is called that joint named as temporomandibular joint.
So when you say clicking, when would I have clicking or what would it be like?
Clicking is so this joint is between 2 bones and there is a cushion between these 2 bones which is called disc. When your disc is out of place and your joint is trying to move, that disc is in the way, it's gonna click.
So it's almost like the disc in your backbone, yeah, kind of?
Yes.
Okay.
Similar to that.
Okay, and what kind of headaches? Because you can have all manner of headaches.
You're probably gonna have headaches in your temple areas, also radiating back to your head of the, neck side. Sometimes headache right around here. That means you're banging your teeth too much in your front teeth.
Gotcha. And then what do I do?
Well, we do 2 types of treatments, invasive treatment and non-invasive treatment. 90 to 95% of the cases can be benefited by just doing non-invasive treatment, like doing the customized appliance specifically made for you to relieve all the pain and pressure. And then invasive treatment gonna be surgeries, which is done by specialists. So we do a lot of diagnostic tests before we estimate whether this case gonna be an invasive case or non-invasive case. We always take minor steps by doing non-invasive therapy first. And if that doesn't work out, then we go for invasive therapy.
How long does it take to fix a TMJ disorder if it's not one of the extreme ones?
So TMJ disorders, non-extreme ones, can be fixed within 6 months to a year. It varies from patient to patient also, how many hours a day they're gonna wear their appliance. The more they're gonna wear, the more, able to fix it really fast. Now, if the treatment is not able to be fixed, then we go for another solutions, like seeing a chiropractor along with doing the TMJ appliances. And then maybe invasive part like surgeries with the oral surgeons. If
I have not an extreme TMJ disorder case, what are you gonna do? What is the appliance?
So we make a special appliance called GNM, orthotic appliance. It's similar like an orthopedic appliance. What we do is we hook you up with some computerized machine. We call them as tense units, which relaxes your muscles because you probably are clenching, grinding. Your muscles are really tense. So we want to relax them down. And then we kind of put a magnet on your jaw and we track your jaw position where your jaw wants to stay when your muscles are relaxed. And we want to take the bite of that relaxed muscles jaw position. It's called an optimal bite position. And on that bite, we make your special customized appliance with micro occlusion in mind.
Okay, so then I'm going to have this appliance. When do I wear it? Where does it go?
We make the appliance for your lower teeth, and it's basically like a plastic appliance which goes over on your lower teeth. You would be wearing it for almost 24 hours except for eating your food, but rest of the time you have to wear it because that's what bringing your jaw in that optimal bite position. If you take it out, your jaw goes back, which was causing you problems.
So it's almost like a whitening tray look. I mean, for me as a patient.
Yes.
Okay.
It is kind of almost like whitening tray, a little bit more rigid, more solid than
right.
whitening tray.
Right, because it's got to do this. It's got to make those changes and make that motion. Okay, but for me, I'm not going to be wearing this headset and.
No, not at all.
Okay.
And it's gonna also clear out any airway problems because it's bringing your jaw in a downward forward position.